Now, when I'm not pushing on it and you just relax, does it hurt there?
No.
Right, just that rest, just with pressure. Yeah. Okay. The skin's looking better. All that flaking coming off.
Right in there.
Yeah.
Now it's not as bad as it was, but I still get them sharp pains run across the kneecap.
Right.
That'll light you up.
Yeah. We'll do 500 of these little pops. So go ahead and put the foot down. See if you can bend it back a little bit. That's it. What we'll do is, without the walker, just stand up and then sit back down, just to kind of get it moving a little bit. Yep. And then you can go right back down. Let's do 3 of those. Yep. Okay, go back down. Let's prop that foot back up there. That's where that IT band comes down, kind of attaches into some of those lateral fibers. Right there.
Mm-hmm.
Yeah. But especially when you get to other areas where it doesn't hurt,
Yeah.
and then you get the one area that does,
Yeah.
it kind of confirms that that area is sensitized. The nice thing about this is it's really one of the few things that you can use over an implant. There's other things that you really can't do after a knee replacement. And when you feel that, does it feel like it's the bone, or does it feel like it's, can you distinguish?
It's just a sharp.
Yeah, yeah. It's incredible you can get that with sound. You know, it's all it is a sound wave. It's just the sound wave hitting it, causing it to shake and vibrate and